Well, good day, everyone, and welcome to another opportunity and exciting time for us during the coronavirus and COVID-19 scenarios to talk to the people of Westchester. This is our first week of being phase one of the unpausing, the 4 stages of unpausing. So we've met the first initial 7 criteria for starting that slow process of making sure that we are unpausing, and we're in phase 1. Today we are pleased to welcome the Commissioner of Senior Programs and Services. You all know her so well for all of the great work that she's done. Say hello to Commissioner Mae Carpenter. Commissioner, it's good seeing you.
Hi, nice to see you.
All right, Commissioner Mae Carpenter has been our Commissioner of Senior Programs and Services for many years, and this is especially critically important as we talk through some of the differences and challenges, specifically because of COVID-19, specifically senior programs and services. The most vulnerable population was the people that were seniors, people that had other pre-existing conditions, but seniors right off the bat, or like, hey, we're going to keep people quarantined and locked in their house, and told them don't open the door for anybody, and make people leave their bags and packages and shopping in the hallway, and don't let anyone in your house, even if it's a family member. I mean, it's been a supremely challenging time. So again, Mae Carpenter, glad to see you. Mae, how are you doing?
Doing fine. We've been very busy.
Well, you've been busy, so let's talk about that. How busy have you been, especially since, again, right from when we went into New York pause and Matilda's law, basically saying we're going to keep everyone away from their parents, their grandparents, our senior community, lock yourself in the room, never come out. That's crazy, right? But that's not what we're really trying to do. We're really trying to protect our valuable members of the community. So talk to us about what you've been doing.
Well, first of all, we want to make sure people are fed. So we've been delivering 12,000 pounds of food a day and 7,000 meals a day to senior citizens, not only those who used to come to our nutrition site or who may have been on home delivered meals, but from calls we're getting, people need to eat. So that's keeping us pretty busy with delivering foods and working with restaurants and everybody who wants to just chip in and help out.
Well, something, and of course, it's not a program unless it has a cool name associated with it. I know Senior Programs and Services, you guys have it called Knock, Drop, and Call, right? That's part of the whole thing. So give us a little bit more about that, because there's people that have been engaged with our Senior Programs and Services, and they know about home delivered meals, et cetera. But again, this is a much, much more intense and advanced program, 12,000 pounds a day.
Yes, well, we are, of course, knocking on the door, letting them know the food is there, leaving the food at the door, and then calling them from the car phones or on their phone to let them know to pick up the food. They used to be able to go into the homes and look around and make sure things were safe, but now people aren't able to do that. So seniors are somewhat isolated from the way we used to do things in terms of not only delivering meals, but also socializing with them. So now it's just a matter of knocking and dropping and calling them, letting them know the food is there and if there's anything else we can do for them.
Well, and that was an important, because as you said, Commissioner Carpenter, that one of those things was the part of the program wasn't just dropping off food, it was checking in on people, making sure that they were okay. And, a person could walk into a place and see something might not be lined up the way that it normally would be, see that somebody might be having some issues, and be able to get them the support they need. And because of COVID-19 and because of all the restrictions that were placed on making sure to keep our seniors as safe as possible, it was now a drop-off program. And that was a change and a challenge to many, many people, because again, we all need, you know me well enough, I'm a hugger, right? And for people that need that human touch and interaction, those things are really important. So talk some more about that.
Right. Well, of course, traditionally, when someone would deliver them food, they would also look around to see if there were there's a possibility for falls, rugs that needed to be straightened out, other unsafe conditions in the home. But now we do that in terms of providing information to seniors so they can check for themselves. And we want to know if they have other problems. We have not only delivering the food, but we do have the telephone outreach program where students are calling seniors and asking questions about changes in their conditions and making referrals. We call that our Tips and Touch program. If you have had a temperature, or if you have felt ill, or if there's anything we can do for you. But the seniors enjoy talking to the students who call them on the telephone. So that's our Tips and Touch program. And we also train volunteers to provide information about caregiving. Many people, when you talk about seniors being alone at home, but many of them are with their relatives, or their aides are still going in. And then, of course, some neighbors might check on them because they know this is a person who needs someone to check on them. So with that program, we are training caregivers. We've trained a lot of new volunteers on caregiving coaching to make sure they are checking for changes in the situation and safety issues, whether or not the person is feeling weak or the person is feeling sick. But the caregiving coaching program is not just socialization and reach out and touch someone and let them know that people are thinking about them, but it's also to find out if there's been a change in their condition and we need to get more help. So we're very pleased with the expanded caregiving coaching program, that training program.
So I mean, you rolled two really cool programs together. One, obviously, the Tips and Touch. How do people get involved in that if they haven't been before? Is there a number, Commissioner, that they would reach out to, or is it something else that's going on?
Well, they could call our 813-6300 number, and we'll be more than glad to sign them up for caregiving coaching, for the TIPS program. Well, now the TIPS program, that's the telehealth program. We're not able to take the measurements or take the tests remotely at this time. We are trying to get some equipment that we can leave in some homes for seniors. But what we do is that we ask 5 questions. The students are trained to ask 5 questions. And these questions are indicators that perhaps we should, that the telehealth nurse should follow up more and perhaps refer them to a doctor, or they should go see their doctor. But it's
people should realize it, and they don't realize that. You were just saying about going to see your caregiver. I mean, we didn't tell people don't go to the doctor. So if you have medications that you need, or you need to see your doctor on a regular basis for whatever things and be necessary to do that level of check-in, the folks, you need to get there, right? And that Tips and Touch program will help make sure that could facilitate those things and get into back and forth to the doctor. Because again, we heard a lot about that. I know when we talked to Renee Garrick, the Chief Medical Officer for WMC a couple of weeks ago, there were people that were not, they weren't doing the things to support themselves for their pre-existing condition, and whether that was heart ailments or any kind of the lung disparities that were out there, or certainly kidney, renals, things that they would go. People need to go to the doctor. So I just want us to echo again: if you need to go to the doctor, we're here to help get you to the doctor. You can't and really deteriorate from a health condition because you don't want to go out and really hurt yourself more. So what was that number again, Mae? Because I know that it came by so fast. I'm too, you're much faster than I am at that. So, let's give out the number again for those folks that are following along with us to be able to call and get in touch for tips.
Yes, well, they can just call 813-6300 for any services for seniors, whether it's a meal or whether it's to talk to someone about a change in your health condition, or in many cases, it's just loneliness. When can I get out? When is this going to be over? You know, I'm isolated. I can't go to my senior citizen center. We hear a lot of those calls. I don't get a chance to go to my exercise class or my dance class or my swimming class. I don't see anybody. And you'll be surprised at how many, this has been sort of a long period. What, 3 months?
It's almost 3 months for us, right?
3 months, yes, yes. So
who's
very lonely, very lonely. So hopefully things will will open up a little bit, and they'll be able to see their neighbors and be able to get out and go walking. And we're providing a lot of transportation. They need transportation to get to and from the doctors or to pick up medications. So transportation is a major service, food is a major service, that social contact is a major service, because people are still have needs. We don't care about this virus. They still have needs, and we have to work with the virus to make sure some of those needs are being met. And
that's important.
Yeah, this is Older Americans Month, and the theme is to make your mark. Seniors make your mark. They've already made their mark. When you think that they got through the Depression and they rebuilt America after the Depression, they've gotten through world wars. They've made their mark. I mean, they have, with all that going on, they still raised families. They still built communities. And they are just good role models for younger people, for all generations, that you can get through this, you can survive this. Look at what we're not going through world wars at this time now, and we're not going through a major depression. Of course, a lot of people have lost income, and we're concerned about people not being able to pay for their medicines, their medication. But we do make sure they get food, and whatever they need, they're gonna get it. All they have to do is call. See, that's the other thing too. You can't be embarrassed because you have to call someone. Everybody wants to help, and that day might come when you might have to provide help to someone. So please call.
You know, so again, they need to make sure that they close, and I'm going to do it just a little bit slower than you have, Commissioner, is 914-813-6300, right?
That's correct. That's correct. Yes.
300, and they would need to call. And again, recognizing that May is Older Americans Month, and you said they're making your mark. And the other side of that, it's also Mental Health Awareness Month. And when you combine what you just said with all of the factors that are in place, people are scared out there. They're not quite sure what to do, right? And there's, as you said, people need to make sure if they're going out that they're wearing a mask all the time. And
that's right. I have mine. I'm just I have my mask.
We're at home in here, so we don't wear our mask at home. However, if we went out into a public area and we're interfacing with people, we'd have our mask. Especially when you can't social distance, and especially for our seniors, it doesn't matter. Throw that mask on, because you're helping protect yourself from anything that might be out there. And if you can, make sure that you got your gloves on. If you got to get into the elevator in some of your buildings and touch things, and I know some folks that they haven't gone to their mailbox themselves. They have their neighbors that check in, but something on tips, can't they also get some additional help on using their technology? Because there's a bunch of folks out there that are older Americans that have their iPad. At least they can do some FaceTiming and have some conversations. And I've seen some really cool TikTok videos out there with some seniors doing their thing out there as well. Right? Yes,
well, a lot of them are reaching out to other seniors who are shut in and having conversations. Here in Westchester County, we have a very progressive senior population, talking about making your mark. These are people who built this county. These are people who built this country. They made their mark generations ago. They're role models. And a lot of them are providing, they don't understand why, when they see on television, young people are not adhering to those safety standards of wearing masks and keeping 6 feet, and everybody's jumping in the pool this past weekend, and beginning to hear that the numbers are going up in some communities where they did this. Older people are wise. They've been through a lot. And we ought to have them on the show to tell people how important it is to take these things seriously. Don't take it for granted.
Well, and that's so important. So we're going to echo that again. It's not take it for granted, but we have to make sure that that while we're talking to people making their mark, to be able to do things in their space, and whether that's on their floor. Well, my mother-in-law is in that category, as you were talking about. She goes around the building and she gets to walk around the floor, go down one flight of stairs, go down and kind of have a little track doing that. And in some communities, you know, there are people that are in communities that they can, you know, walk outside and be socially distant and not have to be staying inside the house. Some people in the senior complexes can't do that same kind of thing, but we want to make sure that they have as much protection as possible. And as you said, every time you see those folks like in the Ozarks, and I think that there may be some Netflix folks out there just losing their mind on Ozarks and binge watching and decide they were all going to jump in the pool. And as the governor said, they don't show the pictures where people are doing the right thing. They of course show the bad picture of people doing the wrong thing. There's many, many more people in Westchester and around that are doing the right thing. And I've seen some out taking advantage of our county park system and walking around with their mask on, socially distanced and that kind of thing. But we definitely need some vitamin D and some sunshine, but we want to make sure that people are safe. Commissioner, one more time, again, you know, about Older Americans Month, because I guess there's more people don't recognize that May is Older Americans Month and, you know, making their mark.
Yes, Older Americans Month, this is when we celebrate the passing of the Older Americans Act, which was passed in Congress. And this is very important. I want to give a plug for the census. The monies for the Older Americans Act and for the nutrition programs and for home health aids that we send out, they come from the census money. So we're encouraging everybody to participate in the census because this is how we get our money. Otherwise, we have to go ahead and raise our property taxes. To
no one do that.
Services. And that has its own problems. So we're encouraging everybody to participate in the census. But the Older Americans Act is to celebrate the passage of the Older Americans Act, which provides funding for the nutrition programs, provides funding for the transportation, the buses we run, provides funding for all the programs and services that we run. But it's also a time to remind seniors that there's still opportunities for giving back, for making this country even greater than it already is.
Well, you know, and thank you for that. Again, because folks, as you said, have already made their mark. They have been trailblazers. They have built this country, and now we're recognizing and celebrating them. But at the same time, we want to make sure that that we are remembering and to say thank you to all of our seniors for helping out and making sure they can reach out and touch somebody, even if it's over FaceTime or the video chatting or whatever have you, to make sure that they're having these conversations and making sure that they are still engaged and involved. And as you said, shameless plug for the census. You know what, when you're out and about, I know that in the food distribution, they've been distributing with the bags that say census on it. I know that many folks have done that. But again, we want everyone to count because everybody does count. And especially the folks that have not had that opportunity that they would have had in their senior center to be able to do their census there. So you can do that over the phone for those that are technically able to do it on the internet. Get one of those grands to help out, right? And you know, do that thing. You can tell them what to do, right? And make sure that everyone does that census because it is so critically important.
Right, that's where the funding comes from.
Right. Commissioner, anything else you want to share with our senior family and all of our folks that are watching us on Facebook Live? We usually get a lively audience out there watching, whether it's live now or when they go back and they take a look at the recording, to tell them what would you want to say to people, especially in this time as we're starting to unpause, to make sure that we're doing the right thing to protect our seniors and our vulnerable populations?
Well, I want to say, don't be ashamed to reach out and ask for help. These are very difficult times, and older people have cared for themselves. They've cared for their grandchildren, for their adult children. They've cared for their neighbors, for their communities, and they might think it's a sign of weakness to not reach out and ask for help. If you need help, if you have any concerns at all, if you just need to talk to someone about what you're feeling, what you're experiencing, what your concerns are, feel free to call and just talk to someone. These are not normal times, but we'll get through them if we all work together and care for each other and reach out and touch someone every day.
All right, and we're going to give the number out one more time to remind people that it's 813-6300.
6300. Yes, I want you to know that we have our phones programmed to our home phones. So when you call that number or call any number in our office, whether it's the nutrition program at 813-6426, someone is going to answer because the office phone has been programmed over to their home phone. The first night that we had the phones programmed, I was working at 3:30 in the morning, and I was calling someone to leave a message for them, and they answered the phone. And I said, what are you doing in the office at 3:30 on a Saturday? And I forgot that we had programmed the phones that Friday over to the home. So I can't be calling all times of night because I'm like,
well, the truth again is that we want to say again, thank you to you and your entire team in Senior Programs and Services. You have an outstanding dynamic team that's been making sure to take care of people right from the very beginning. For us, we started a little bit earlier in Westchester and New Rochelle with the containment area on March 3rd. So we March 3rd to right now, Senior Programs and Service was already rocking, but we took it to a whole new level to get everybody the help that they deserve. And that's really the important thing. It's like, it's not, don't be ashamed, as you said.
Don't be ashamed.
Earn it, right? So whatever.
Don't be embarrassed to ask.
All right. Well, again, thank you, Mae Carpenter, Commissioner of Senior Programs and Services, for being with us on Facebook Live. For all of our folks in Westchester County that are watching, again, we're in phase one, we're unpausing. We want to be careful to make sure that we don't take any steps backwards. But if you need help in the senior services, make sure you call 813-6300. Thanks a lot for watching. Stay safe, everyone, and have a wonderful day.
Thank you so much, Ken. Goodbye.